Do you know just how doctors get paid, how health insurances work? Do you know why and how Medicare covers seniors and then reimburses doctors and hospitals? It is quite complicated, and we're going to do our best to explain most of it in upcoming videos, blogs, and seminars. Let's begin with the most complicated scheme ever created by humanity. In fact, it's so complex and involved that only a few brave souls can ever claim that they understand it all. And no, I'm not talking about quantum mechanics or theory of relativity. And in fact, this guy would probably flip a bird rather than flick a tongue if he had to deal with any of it. Naturally, I'm talking Medicare. But first, a bit of history lesson. On July 30th, 1965, President Lyndon Johnson signed the Social Security Amendments of 1965 into law. This landmark legislation established the Medicare program, which provides hospital insurance and medical assistance to Americans over the age of 65. At the time, President Johnson said, and I quote, "No longer will old Americans be denied the healing miracle of modern medicine. No longer will illness crush and destroy the savings that they have so carefully put away over a lifetime so they might enjoy dignity in their latter years." And that sounded good, real good, like our government was going to take care of all of our seniors. And that was a long time ago. It was like 42 years before the first iPhone. The impact of Medicare's passage and its implementation had profound effects for patients and doctors alike. All of a sudden, the idea that federal government would play a big role in healthcare was created. Within a few years, Medicare was covering huge parts of the population, and people came to expect it as a right, and with some seeing it as part of healthcare system. Doctors and hospitals began to depend on it for money and benefits. And of course, over the years, the program changed significantly with different government regulations and stipulations, and there were a number of efforts to expand it. Most notable, which was not until almost 30 years later after its inception. And yes, it was Bill Clinton in 1993 who drafted a task force chaired by none other than First Lady Hillary Clinton. And the main objective was to develop a universal health care program, but shockingly, this new reform faced opposition and legislation failed to ever come to a vote. Then, fast forward 10 years later, George W. Bush signed into law the largest expansion of Medicare since its creation. It was none other than a $400 billion Medicare Prescription Drug Modernization Act, also known as Medicare Part D, so that people covered under Medicare could now afford their prescription drugs. It was the first step for private plans to compete with Medicare and to subsidize insurance companies and healthcare maintenance organizations. In fact, George W. Bush said, and I quote, "Our nation has made a solemn promise to America's seniors, and we have pledged to help our citizens find affordable medical care in the latter years of life. This is the act of a vibrant and compassionate government." But of course. And the next single most important change in overall healthcare delivery in the United States was, of course, the passage of Patient Protection Affordable Care Act, also known as Obamacare, in 2010, like 3 years after the first iPhone. So this act required that all Americans obtain insurance or pay a fine, and it also put new rules and regulations like prohibiting healthcare companies from discriminating against pre-existing conditions. However, this act did not include a public health care option for those who were not eligible for Medicare and Medicaid, thus keeping Medicare essentially unchanged. So as you can see, we're sitting here almost 50 years after the first introduction of Medicare, and it still seems a little complex. Remember I mentioned that Bush introduced Medicare Part D? Now, does that mean that there are Parts A, B, and C? You bet. Wait. You say, shouldn't Medicare simply be a plan that covers seniors who are sick, and when they get sick they go see a doctor or be treated at a hospital and get better? Yeah, but that would be too easy. So instead, a modern version of Medicare has 4 parts. Part A covers hospital stay. Part B covers outpatient doctor services. Part D, I'll talk about Part C in a minute. Part D adds prescription drug coverage to original Medicare through private plans. And Part C, now here's a kicker. It's a Medicare Advantage plan that is offered by a private company that contracts with Medicare to offer you Parts A and B. These are typically healthcare maintenance organizations and some preferred provider organizations. And some Medicare Advantage plans also offer prescription drug coverage, Part D. So, C equals A plus B, then sometimes C equals A plus B plus D. Remember I said it was complicated? Now, how does it all work for patients? Well, if you're 65 and over, you automatically qualify for Part A, hospital services, and these services are typically covered at 80% of hospital fees. You're also eligible to apply for Part B at a cost, and then Part C and D at more cost. And these costs typically vary by your location, and they increase as you get older. And it's important to remember that these costs are not insignificant. What was that George W. Bush said? Vibrant and compassionate government. You decide how true this is. Now, how do doctors get paid from all these parts? How do doctors get compensated for Medicare? From Part A, B, C, D? Is there Part E? Stay tuned.